We have always fought for the best care of our patients, and we will continue to do so today, tomorrow, next week, and next year. We're going to continue the fight for the best patient care because that's why we came into nursing.
The most vulnerable of our citizens are at risk, our children and our elderly. As a Republican, I'm begging, please do not cut Medicare and Medicaid. Our patients need it. It's too important. We won't be able to care for those that we have pledged our lives to care for.
Are we the kind of people who stand back while others struggle?
No.
Or do we look out for each other and make sure our friends, family, and neighbors have the security of health care?
Yes!
We need jobs, not cuts. Now is the time for Congress to stand up for American families.
Senator Reid comes from Nevada, obviously. Times are tough. More people are unemployed than any place else in the nation. And he knows that these people need medical care just like everybody else.
A lot of my patients, especially my patients, they have Medicaid in order to get through their pregnancy. And if we don't help them get through the pregnancy, we have ICU babies and that are very sick. And if they don't get the help then, those ICU babies end up being in the hospital, staying in the hospital even longer. Those costs are going to be even worse if we don't help them from the beginning.
The healthcare law is here to stay. We are nurses and we care for our patients.
So we are here to give you all the facts.
They serve at bedsides across the nation, and nurses are concerned about the impact on their patients of the Romney plan to privatize Medicare. Kathy Stoddard, a nurse in Ohio, says these changes would impact families who are already struggling to make ends meet.
If Romney and Ryan are elected, seniors are not going to be able to live in nursing homes because Medicaid pays for that. People are going to be sicker.
My fellow nurses and I are going to continue to speak up in our communities and tell the truth that this president and his administration stand up for women's health.
Because we say that we have to make sure that not only are we going to protect and defend Obamacare, but we're going to vote for a president that's going to ensure that Obamacare is implemented.
I think people who are opposed to the Affordable Health Care Act should meet a father I know who has 4 kids, 2 have asthma under the age of 7. It took 3 weeks for him to get the medication that his son needed for asthma, and he ended up in the hospital before he could afford the medication. And, you know, Why can't they have health insurance? What did they do?
A few years ago, when we were fighting to get the Affordable Care Act passed, what I saw at the time, my patients were coming into the hospital really, really ill. Their first meeting with the doctor was in the emergency room. 2 years later, my patients are not as sick. I already knew it was a good thing. I'm like, oh my gosh, it is making a difference. So I do talk to my patients too. Whatever I find out, I inform them, what do you know about what's available to you?
The U.S. Supreme Court hearing on the Affordable Care Act begins today. Registered nurse Jean-Ann Jacoby in Bay City is with the Nurse Alliance of SEIU and says her hope is that the law stays intact. She notes that the law's recent inclusion of young adults on their parents' health insurance policies brings a measure of family security.
That's a really big plus for a working parent, not have to worry about a child that has a McDonald's job should they get hurt or sick or something.
Roshana Abdullah, an RN in Las Vegas, Nevada, says this law is critical for the patients she treats who are working but simply have not been able to afford the cost of care.
The economy being the way it is and people are not insured, they come to the hospital, they have hypertension, they're not able to pay for the medication.
We had a 25-year-old previously uninsured but now covered through her mother's insurance plan come to us because she found a suspicious lump. It was cancerous. Her access to our clinic probably saved her life.
Yesterday, the Supreme Court upheld the constitutionality of the Affordable Care Act. Nurses on the front lines of care reacted to the ruling, saying it is a victory for patients across the country. None of the benefits of the Affordable Care Act that have already taken effect will be rolled back. And that's a blessing, says Denise Glass, an RN from Miami.
We're going to be able to provide the type of care and the quality of care that we want to on a daily basis.
You're going to see that in the long run, it's going to save the country a lot more money.
The $52 billion that we gave our taxpaying dollars for that is going to go to another state should come back to Florida. We need it. There's 1.2 million Floridians that are hard-working people. They need that money to help them so they can also have health care.
As an SEIU nurse, I was very active in getting the act passed. We ran petitions, we did all kinds of actions, we did marches to support the healthcare effort. I feel really good about being here.